Hello and welcome to another one of our videos where today I'm going to look at the role of, say, knee braces and whether or not they really do anything in terms of preventing further knee injury and supporting the knee joint itself. So let's get into it and have a quick look at what we find. Alright, so what do knee brace, or we should say sleeves here, because there's a difference between a brace and a sleeve. A brace is the top picture here. Very much what you would see after an ACL injury to assist in the joint being kept stable so it can repair and do the healing. The sleeves are what you would play with sports in. So what we're going to be talking more about here is the role of the sleeve, which is what you would see quite often in sports and even in gym settings and so forth. Right. So what do they actually do? Well, it helps increase blood flow. Which in turn helps keep the joint warm. If the joint is warm and it's got better blood, it has better flexibility, has better chance of moving. With these little holes that sort of have the kneecap sort of sticking through, helps to sort of reduce that patella moving around, which obviously then gives you a better chance of activating the VMO and enhancing proprioception. Which really leads to the next thing, which gives your mind and your body a feeling of stability, that it's better with it on than if there's nothing there. All right, so they're the things that we've sort of been shown to improve, although there's a lot of research saying that it really doesn't do all that much, but mentally, as you would see, it's a big thing. So there's lots of studies being done, and there's plenty of books you can find and research papers. A lot of it is inconclusive, but there's one here that they did that had roughly 1,400 cadets from the academy, and that the knee brace did not significantly decrease the severity of ACL and MCL injuries, but there was a trend towards the reduced rate of less severe ones. So out of 16 ACL injuries, 4 in the brace and 12 with no brace. So the thing to get out of that is it does sort of help, but it doesn't actually do everything, which is, I think some people think that this is really all they need to do and they can go back to running or playing basketball or whatever sport they may have played. Understand it, if you don't really address the problem, it's very risky. The sleeve is not really going to be able to do a lot for you. I touched on this a second ago. The mental thing is arguably the best thing. So the sense of feeling of creating more stability sort of helps the person feel more in control of what they want to do. So whether or not it's a placebo or it really does it doesn't matter, because if the big thing here is that the person doesn't guard their movements, and if they've been practicing doing some gym movements or learning how to do stuff, there's a good chance that they're going to be learning what they should have had in the first place. And they're going to recruit the muscles in the right order. Whereas if they went to playing the sport or doing whatever they were doing without the sleeve and feel like they need to compensate, this compensatory movement is almost guaranteeing further injury. Maybe not even at the knee, it could be at the back or in another joint somewhere else, because the compensatory movement is what's going to really undo everything, and it's just a chain reaction of bad news from that point on. So the impact of the sleeve, whether or not it's physically doing anything, the mental security from it, helping you to move better, is a big thing. So there is definitely a role. I'm not discounting that you don't use them. I'm just saying that, and you'll see in a second, if you're using this in conjunction with the things that will really change it, it can really help you to get it done a lot faster and safer, and in the end you probably won't need the sleeve anyway. So the big thing here to understand is the sleeve doesn't fix the problem. While it might provide some security, understand it is just really doing a minimal an effort. The corrective exercise program will do it. Surgery won't solve your problem either. Surgery is just a band-aid approach of treating the symptom, and it's not really addressing the cause of the problem. If it was from a car accident or something, you'd say, well, fair enough, surgery was very useful here. But if it's from a sporting injury, and most of them are non-contact, from twisting, turning, landing awkwardly, maybe an overuse problem if you're a runner, these are all postural and movement and muscle and balance problems. There's dysfunction somewhere within the joints of the body, and how your brain's preparing you to move that's causing your problem. If you do not identify what that is and address that at the source, you'll always have a problem no matter what stuff you do with sleeve surgery and all those band-aid treatment approach. All right, so where do you look? Well, there's 4 common factors. There's probably more than that, but if I really simplified everything for you, these are things you want to look at. Tight ankles, I could probably almost also say weak feet, tight hips, weak glutes, weak abdominals, core, I could also expand into that, and overall, on top of all of that, you might have all those top 3 all fine, but then you've got a movement dysfunction, and the way you move is the problem. You have stability problem when you try to move. So we quite often might see that. We might see people in a relaxed position, the ankles are quite flexible, there's nothing wrong, as are the hips. The glutes cannot function when they're in a isolated fashion of a clam or a bridge hip extension type activity. Yet when the person tries to squat or does a lunge, or especially a one leg thing, there's heaps of stiffness present, and there's a terrible method of how they move. All right, so that would be an example of where there's a problem within the nervous system, nothing that's like a biomechanic problem. Whereas other people, it is a biomechanic problem, and it could be the tight ankles that ruins everything. And in the case of this picture here, shows, say there's an ankle problem that doesn't have mobility, the foot's excessively pronating, then the leg internally rotates, the knee shifts inward, which now creates a problem at the knee. The hips are not strong enough to correct it, the hips become tight, weak glutes. You can see it could start at one end, it could start at the other end, it could be at the brain. It could be any one of these factors. You have to identify which one it is and then have a plan in place to correct it. Which one started it is hard to say, but it doesn't really matter, because you can guarantee all of these things are going to happen if any one of these factors are a cause of it. All right. So sleeves won't prevent your anterior, the anterior cruciate ligament tear. The stability must be provided by the muscles and the ligaments to do so, to prevent it. All right. The sleeves will just, again, like we've said a few times, create a little bit of that security and hopefully do things, but make no mistake, if you cannot do this with a sleeve. So it's very risky if you've got like some sort of ACL tear or even patella tracking problems, and you're not addressing it with a corrective exercise program, and you're relying on the sleeve to do it for you. You will probably have pain very, very in the near future. All right, so address the dysfunction at the ankle, the hip, the brain, faulty patterns, and learn how to stabilize and then strengthen. So the way we go about it is, because you don't want to start at all the advanced stuff, you've got to start at the very simple things, and there's a reason that we follow in an order like this. Well, firstly, we want to assess you, so we need to find out, okay, is it a flexibility mobility problem, or if it's not, then we start to look at stability things, which we'll only find in a standing position. If there's no stability problems, then there's a strength deficit. It's always in this order, right? And the reason is that the tight muscles will inhibit weak ones. All right, so if there's a flexibility mobility problem, you'll never achieve stability, because you can't even, before you've done anything, even get in the right position. So you have to be able to get in the right position. Once you know you can get in the right position, you need to learn how to stabilize the joints in the correct order using the correct muscles. And the sequences and timings of things is everything. Timing's everything for stability. You can't develop strength if you don't have these two things first. So I see so many people skip these steps and go straight to here, doing heaps of glute stuff, hip extensions, whatever, but they haven't addressed the problems here, and they will never progress to here, which is where the sports is played. This is the explosive, powerful stuff. All right, and this is where the risk is, and that's where the danger is, if you haven't addressed these 3 steps first. All right, so here's an example of a mobility for an ankle. If you can't get that, then you'll never be able to get the angle of the knee here, which you need for a squatting, and which you need for jumping, and you need for landing. In this one, this is where you've got a bit of stability, and if you can't control this sideways force of the glutes here aren't controlling, if his foot's too stiff and rigid, and he loses his balance from taking his big toe off the ground, he's going to have trouble. So he won't be able to stabilise himself to be able to move his arm. All right, so these are just two examples of some things that we may use or look for. To tell you exactly what to do is almost impossible for this video. It would go for an hour, but and there is an hour-long video, which is this one here, which I do show you all these things, and I show you in the order that I've just discussed then, of how to address and identify mobility, stability problems, and then how you go about correcting them, and also moving into progressions of strength and then power, all done in a safe and secure way. So if you do have knee pain right now and you are relying on the sleeve and you want to know how to, and you don't feel like you're moving as effectively as you could in your sport, then this is for you. All right, so you can go to these links here go to our website, and there's an online shop, and you'll find where you can get your hands on that. All right, so in summary, sleeves are great. I do encourage you to use them if you have an injury or you've had one in the past, but just know that they are not fixing or correcting anything for you. Only a corrective exercise program designed properly will do so. Always look at the other joints. The knee is the one that's not really, it's just the effect, it's not the cause. So ankle, hip are usually the two big ones, along with the faulty movement patterns. Single leg squats are going to be the big bang for your buck exercise, but you can't go straight to that if you haven't done these other things first. If you haven't addressed them, you'll never be able to do this right anyway. So, and then once you are able to do it right, you've got to make it stronger than before, which then leads you to the plyos of jumping and stuff like that. All right, so I hope that helps to shed some light on the use of sleeves, and I hope you have gained some extra knowledge and you can go about doing what you really need to do. And like I said, if you do all that stuff, you probably won't need the sleeve in the end anyway. All right, so I hope you enjoy that, and I'll see you on our next video.